This is Lilybeth. I'd like to thank her for volunteering to help us demonstrate the use of the Spinemobility Bolster. In general, there are 3 specific ways that the bolster can be used. One for practitioners to help them implement the treatment protocol and the therapy techniques of the stenosis protocol, as well as the persistent low back pain protocol. Second, for clients and patients to assist them in performing some of the specific exercises in these bootcamp programs. And finally, for patients and clients to help them reduce symptoms of back pain and leg pain when sitting and or lying down. Now we're going to demonstrate how to use the Spinemobility Bolster when implementing the treatment protocol for spinal stenosis and the persistent low back pain protocol. We're going to get Lilybeth on her stomach. The bolster is positioned on the table with the pelvis, specifically the ASIS, which are these 2 little bones, in the center of the bolster. And this goes down for supporting the head. Now, the various techniques are outlined in our bootcamp programs, but in short, there's mobilization techniques that you can do, as well as trigger point therapy, as well as sacral pump. The key thing is that the bolster is introducing flexion in the lumbar spine. You can see that the pelvis and the tailbone is high, the head is low, and the feet are low. This introduces flexion, which maximizes the opening of the spinal canals in spinal stenosis. It also reduces facet imbrication in patients who have facet syndrome or degenerative back pain. It also releases the tension of the sacroiliac joint for patients that have sacroiliac joint dysfunction, and also patients who have far lateral disc herniation. These patients also prefer a flexed position. So that's the preference that these patients have who have all these conditions, and flexion, the bolster helps to introduce flexion when providing the treatment for those various conditions. We can also stretch the gluteal muscles. We can also stretch the iliopsoas, which also, when it's tight, introduces extension. All these maneuvers are outlined in our bootcamp protocol, but the bolster, again, helps to facilitate flexion and helps you maneuver the patients without aggravating their symptoms, and also help facilitating intersegmental flexion. The next maneuver you can use the bolster is when the patient's on her side. We're going to use the bolster to support the head while you're doing the side posture maneuvers, and these side posture maneuver is specifically aimed to introduce intersegmental flexion. The pillow supports the head. The spine is aligned with the rest of the head is aligned with the rest of the spine. You're introducing flexion here, and then you're also introducing flexion and stretching and doing neuromobilization as well. There are a number of other techniques to do in the side posture, but again, the pillow helps to support the head while you're introducing flexion with maneuvers, as well as stretching the various muscles that are actually impacting the lumbar lordosis. And finally, when the patient is supine, the various maneuvers in the supine position include neuromobilization and stretching of the glutes and the erector spinae, but the patient is in a flexed position. The lumbar lordosis is reduced because the patient's in a flexed position, so that maximizes the opening of the spinal canals, particularly in patients who have the radicular form or the mixed type of spinal stenosis. Also minimizes facet imbrication for patients who have degenerative back pain, facet syndrome, sacroiliac joint dysfunction, and far lateral disc herniations. So while the patient is in this position, there's also flexion of the knee and the hip, reduces tension of the sciatic nerve, and reduces symptoms in the leg while you're doing things like neuromobilization, hip flexion, stretching the glutes, all the maneuvers that are outlined in our bootcamp program. Now we're going to demonstrate how the bolster can be used to perform some of the specific exercises outlined for the spinal stenosis and the persistent low back pain protocols.